Naama Stauber Breckler grew up on a moshav, an environment that encouraged a lot of exploration. She was an officer and software engineer in the Israel Defense Forces, and then she worked for defense and security companies before moving to the US a decade ago. At Stanford Business School, she found her calling in healthcare through cross functional collaboration on unsolved problems, starting with catheters. She learned through her startup experience about deficiencies in distribution and patient support, and she decided there had to be a better way. And then she founded Better Health, a startup that takes urology and ostomy supply to the next level with simple processes, personal consultations with experts, peer coaching, and education. It's the kind of experience I would want for myself or my loved ones. In this episode of the Health Biz podcast, Naama explains what's better about Better Health and how the company is striving to bring value-based care to a corner of the healthcare market where it hasn't really been seen. Better Health is ramping up. They just announced Series A financing led by experienced investors. I'm David Williams, host of the Health Biz podcast and president of Health Business Group, a strategy consulting firm that helps companies like Better Health to develop robust growth plans. Reach out to me, dwilliams@healthbusinessgroup.com, if you'd like to discuss strategy for your company. And finally, please remember to subscribe to the Health Biz podcast. Naama Stauber Breckler, co-founder and CEO of Better Health. Welcome to the Health Biz podcast.
Thank you, David. It's great to be here.
We're going to talk about Better Health, which is a great subject to talk about anytime. But before we do that, let's talk about how you got there. Maybe a little bit about your background, your upbringing. What was your upbringing like? Any big childhood influences that stood out?
Well, I didn't grow up in the States. I grew up in Israel. So I moved here about 11 years ago. And I grew up in Israel in a place called, it's a moshav. A lot of people have heard about a kibbutz and kind of know what it is. It's this kind of shared little community. So moshav is similar in the size, very small. You kind of know all your neighbors, but don't really share resources. So in a sense, it was very safe. Like you knew everyone. You could have gone into a neighbor's home just if you wanted a cup of water or used the restroom as a kid. And I think it was really kind of an environment just encouraged a lot of exploration. Grew up in Israel, of course, military is compulsory, went through the military, was a software engineer there, spent about 6 years, was an officer in the military. And after that, joined a security startup before moving to the US for graduate school. That's in a nutshell.
Yeah, that's quite a whirlwind. Well, sometime we'll have to go to the moshav. I do know what a moshav is, but that's a good description of it. So it's like not a kibbutz, but you know, start
Yeah,
there and then you'll figure it out.
I kind of explain to people in the US, I say it's a little similar to graduate school. It's like you want to live next to people that you know and you like, and you have education committee and social committee and whatnot. So really kind of shared maybe values and experiences and really build a community together.
Very nice. All right, so you came to the U.S. and for graduate school, but also a shift to healthcare because you've been doing software engineering, defense, security field, but then a series of healthcare experiences. So why the shift to healthcare, and then what were you doing on the earlier healthcare work?
Yeah, so I did start my career in defense systems, then worked in security. Security is so big in Israel, and because I was really excited to kind of get deeper into a deep technological challenge. But I think what that experience taught me, I was working in a company, it was an early engineering company called Forska Technologies. It was a startup. Later, it went public a couple of years ago, and well, the company was great. The people were great. The technology challenge was big, but I didn't feel that like calling and mission, and it was too far removed from the people that my work actually impacts. And I think with that kind of feeling of missing something, that's kind of I came to business school and felt like I want to find again something that I'm excited about, a mission that I can work on my entire life. And in healthcare, I really found all that. I think. What I really love about healthcare is just how tangible the impact is that you have on people's life, and how you feel it in every day in your work. And the way I got into healthcare, when I was in Stanford, it's an amazing place. They really kind of open all the opportunities to explore many new industries, career paths, just really open your mind. And there's a really special institute in Stanford called the Institute of Design, the D School. And in
Hmm.
that, they bring people from different disciplines to work on different problems using design thinking methods. And there, I started working on what turned out to be my first company, Compact Cath. So we worked with the chief pediatric urologist at Stanford, a group of nurses, a group of patients with chronic bladder issues. And we were a team of engineers, business students, physicians, and me and another guy who's a physician who started this class together. A group of us continued to work on the problem, and when we were about to graduate, it just felt like too good of an opportunity to pass
Yeah.
on. And that was born into Compact Cat. So we basically identified this gap in the market for people with chronic bladder issues who need to use catheter, not in the hospital, but intermittently. So imagine every time you go to the bathroom, if you have severe retention, you need to use a catheter. So that's an average 6, 7 times a day. And
Yeah.
these products haven't really been invented on actually in almost 2,000 years, because catheters have existed for a long time.
Right.
So the materials change a little, but it's still this big, bulky product. And if you go to work, go to school, need to carry 6, 7 of these, you need a whole backpack just for them. So
Yeah.
we invented this very small catheter that rolls up, and you can, put in your pocket, carry a few with you, and use on the go. And we took this product through FDA reimbursement, all that kind of long path, all the way to market. Now it's selling all across the nation. But in the process, we thought, Bayer doesn't need to create a new pharmacy when they have a new drug. We can work with existing distributors. But when we started the process, it just was really difficult to work with, and really kind of found out there's no really an incentive to introduce something new or better to patients. So
Right.
we had to build our own channel, direct to consumer. In the process, just talk to tens of thousands of people who use these products, and really understood that, wow, there's a bigger systematic problem to solve. It's not just about inventing better products. It's really about how do we improve uh, the ease, the convenience, the discovery of these critical medical supplies, um, and help people who need to use them get them, and be educated and gain the skills on how to use them effectively and efficiently, so they can, regain their health and live confidently at home.
Great. So that's compact cath. So that sounds good. How about avails?
Avails is an incredible company that is really revolutionizing rapid detection of an infectious disease. It's a really special story. One of a few friends of mine who were postdocs at Stanford, physics, biochemistry, had this amazing technology, and there were a group of scientists who all their life just did, research in science. Brilliant, and really needed kind of that help in finding the first application, and thinking of how do we build a business around it. And they invited me to join them, or ask me to join in this journey. And the company has grown quite a lot. It raised multiple rounds of funding. The technology is really like a breakthrough technology. Like once it's commercialized, it can really dramatically shorten the time it takes to treat people with critical infections. And um, and it was a very different journey, to be focused on something that is, such deep science, but to be able to bring that, business experience that I have in the market, and help find the right application for it.
That's good. Well, I said we'd speak about Better Health, and we're going to talk about Better Health, the company now, but it sounds like you've been working on Better Health ever since getting uh, to the US or getting over to business school. So,
I think the seed for better health came from a lot of these experiences of working, in diagnostics company, on Compact Cath, which is a medical device, on Mocha Care, and going through all the different stages from, inception to commercialization of a product, and getting to know the supply chain much better, which kind
mhm.
of which build that experience of understanding that we have a gap in the market today, and that's in how do we bring these, amazing products and innovations to the end consumers who need them. And that was the seed for starting Better Health.
So with Better Health, you talk about it coming out from the kind of product invention and commercialization standpoint. There's a lot of companies out there that sell medical supplies. So what's wrong with what's already out there, in addition to what you said about the challenge of getting new innovative products to market. But like what's wrong with all the dealers that are already there?
Well, a lot of them are doing great work. Actually, the medical supply industry, the durable medical supplies, it's one of the last cottage industry. You have a lot around 20,000 players, a lot of small mom and pop shops that we see in every town. A lot of them existed for many many years, and then you have a bunch of national providers that are really companies that have been around from the kind of pre-internet era. But I think the experience often feels like it when you go to a small store, just by the sheer physical restrictions, you have a limited selection. So you might have a little bit of each. But one of the things that we found out, and just from talking to our customers, is that when it comes to medical supplies, there isn't really one product fits all, and it's very personal because if you are using a product like a catheter that you insert into your body multiple times a day, or an ostomy bag that you wrap around your body, one would feel really different from another based on your specific condition, age, anatomy, etc. So finding the right product really matters. And part of the challenge also with the big national providers is that a lot of them were built more, and that's just the nature of the industry, as supplies and logistics companies versus consumer or healthcare or technology companies. And that's what the experience for the end consumer feels like. So whether you go to a local store or work with a national provider, it will just be a very lengthy experience. The patient needs to basically become their own care advocate. So coordinate between the doctor, the insurance, the supplier, testing out different products, making sure they're not overpaying for things, and doing it all manually. So spending hours on the phone. And if you have a chronic condition and you need these products every month, that can be a repetitive experience sometimes for the rest of your life. And that's really where we're trying to make a huge difference. If you think about it, a lot of these products, there is an education part. There is a part of helping you with a more clinical part. There's a part of helping you find a product that would work for you. But ideally, we'd get you to a place where it's kind of a, autopilot. You find a system that works for you, you have the skills, you know how to do it. So now, why would you need to spend hours with us on the phone every month? Why not make it as easy experience as subscribe and save on Amazon for your medical supplies? So we're bringing is this ability to do what you do today in a very manual way, to do it in a click of a button, and really create a lot of transparency around your benefits, your orders, your shipping, your cost, and everything that's around that.
Great. So then sounds better health will be better if you can do all those things. But there's some challenges that are out there. And one thing I noticed on your site is that you offer a lot of added services that make sense and that I would want as a patient. But you know, presumably at least some of these other companies are aware of the need for that too, and they don't offer it. And I'm wondering, is there an added cost either to you or to the consumer? Do you have a different revenue stream to be able to support that? How can you offer this more comprehensive set of services than what you typically see?
Yeah, yeah. So you're right, we do offer additional services. And again, that's part of that realization that supplies, it's not just about the logistics and how do we get them to you. It's really how do we help you be effective with it? And how do we help and prevent you from going back to the hospital for things that are pretty common, like maybe you'll bleed when you use a catheter. Maybe you have a skin irritation around your stoma, and that's where we can really make a difference. And in terms of paying for them, so there are definitely additional costs for offering these services. But what we are able to show in one of the white papers that we've been working on is going to be published soon, is that really by offering this additional support, we're able to really impact people's health outcomes, both physical and mental, and their overall utilization of care. So our goal with time is to be able, because we're able to create this additional value, to be able to basically shift from a fee-for-service base that is generally used in healthcare and also in medical supplies to a value-based one. Um, and then in the short term, a lot of these services are actually, we are able to cover them through insurance. So, whether if it's a doctor consultation, nurse consultation, a lot of these are able to be covered by insurance as well.
Talk about the difference between, say, different patients, not so much by their health status, but by insurance status. It's different, in my experience, between someone who has Medicare coverage, traditional Medicare or Medicare Advantage, versus Medicaid. And then Medicaid has differences between the different states, and then even among the different, specific programs for people with disabilities and so on with Medicaid, and then your commercial payers. Do you see a distinction, or are you able to basically approach each patient in the same way?
There's definitely a distinction. Our goal is at the end of the day to give all the members a similar experience and offer the same benefits to everyone. So where there is a distinction and difference is in the technology and what happens also behind the scenes for us. Um, the entire world of health payers, health plans, benefits, coverage, co-pays, deductible is so complicated. I can tell you that even I, until I got much
You
deeper
can
into
you
this business,
you
did
can
not
admit it.
understand.
Yeah.
Totally did not understand. I think so many of my friends also, what's the difference again between deductible and copay? So it's just hard to understand. So there's no surprise today when people go and they think I have an insurance, and then they go to the doctor and they get 2 weeks later a letter in the mail saying, "Oh, you owe us $1,000." In that experience, we hear it a lot from people who need to use medical supplies. And our goal is really in creating better health is to add transparency and prevent these unfortunate, surprises. And so what we need to do behind the scene in order to give you that dynamic estimate is really connect to your insurance, read that information, understand your benefits, your deductible, your copay, and be able to give you an estimate based on what you need, what would be the cost, and what your options are.
What's your level of optimism on the value-based care front? So what you just described makes sense, right? You can show that if you add services which add certain specific costs that you can identify, then you're going to have better outcome and maybe lower cost. And it can be easy to justify if someone can stay at home versus having to go into a facility or into the emergency room or hospital or whatever. And on the other side, you have people that are, let's say, managed care executives that may look and say, if I'm not paying for it now, why do I want to pay for it, in the future? And it's going to depend. That's why I was making that distinction between, Medicare Advantage has different uh, compensation arrangements and different ability to benefit from,
Right.
the scores they get from the Medicare, the stars ratings from, based a lot of it is based on the satisfaction of the patient. Whereas Medicaid may be more of like a fixed budget and sort of I don't want to pay for that, and even they have more people in Medicaid, but they don't have more money for it, so they just try to cut you on the unit price. I'm glad you've got the enthusiasm to go after it, but I know these are easier said than done.
It's true. So look, our our healthcare system is so complicated. It's such a massive. It's one, $3.8 trillion, right, a year. It's a massive industry. It's so complex. So definitely, change takes time. But I do feel very optimistic about the direction towards value based care. I think it just makes sense to have the incentives aligned. And the fee for service models just has a lot of problems that we see it again and again. It's like if the system and the incentives are to generate more services and bill for more services, that's what's going to happen. So instead of you know overly like monitoring it, investigating it, looking into every detail, let's change the incentive that it will be really geared towards how do we create a better long-term value and better health results. So I think COVID actually, accelerated a lot of change and a lot of innovation. And I hope this will stay with us and kind of continue to bring the future, to the present faster.
So let's get away from all the insurance because that's a depressing topic. Talk about, when you've been able to help sort of specific patients. Can you give an example of like what success looks like for an individual? What that experience might feel like for somebody that is going through and getting. I mentioned the added services, but I like the whole package that you described. Can you talk about like what the patient journey is like for someone who would work with Better Health?
Yeah, absolutely. So, people, we started the company doing a lot of direct to consumer. Now we have national partnership with Humana, with Oscar Health. We have a preferred partnership, Blue Cross Blue Shield of Illinois, and many other payers. So we also get referrals from our partners. But people can also find us just online. And that's, we meet people in different parts of their journey. So they can be completely new to a condition, and maybe the doctor just gave them a few samples of catheters, or maybe they were post surgery and the nurse explained to them and gave them a few things to take home with them. Or maybe they've had the condition for 19 or 20 years, but are having challenges because, again, when you have a chronic condition, it just changes throughout your life course. Some people called us and were like, I gained 30 pounds in pandemic. My body looks different. The ostomy bag doesn't work anymore. It started
Right.
leaking. Now, I think one thing that maybe sometimes it's hard to understand because a lot of people are just not familiar with a lot of these conditions, is that when it comes to medical devices, it's not the same as like taking a pill. You know, this is for your liver, this is for your heart. You take the pill, you drink water, you're done. A medical device, you interact with each one of them differently, and one can work very different than the other. So, for example, we had a one story that comes to mind is a woman that have had an ostomy for many years. An ostomy, for those who don't know, it's if you have GI problem, Crohn's disease can develop to it, or ulcerative colitis that require to take a piece of your intestines out, and your output goes out through a hole in your abdomen, basically. So there's a whole system that kind of collects that. So this woman gained a lot of weight during pandemic, and her system just didn't work anymore. It started leaking. This leakage can be pretty acidic and create irritation around the skin. And what happens is that it really impacts every part of your life. You can't leave the house because you're afraid you will leak. You suffer from pain because of your skin irritation. It interrupts your relationship, exercise, going to work, everything. So we were able, with one of our peer coaches, to help her and basically troubleshoot through it. So troubleshoot through what is the new right correct size of your stoma, what does the skin look like around it, so we can find a system that works better, add an additional barrier, and eventually ship a new set of products to her that were able to just work well, and she could wear them for a few days, no leakages. Let the skin heal over time and just kind of go back to normal life, to her routines, to going out, etc.
Great. That's a good story. So anyway, obviously there are people that have done their diligence and believe in what you're doing, because you just raised and announced a new funding round. So what's that about? Who's leading it? And how are you going to invest the latest proceeds?
Correct. We launched our product on April 2020, so right after pandemic, and it was really, I could say, pandemic, I think, generally created a lot of positive also change in healthcare. And I think we felt it a lot because a lot of the people that we serve are, like you mentioned earlier, Medicare, Medicaid population, older ones that during pandemic were more vulnerable and could not leave the house. So they turned to look other alternatives, and that's where we could really help. So we've grown a lot during that time. We've grown around 30% month over month since we launched, and we raised our A round just recently. It was led by Caffeinated Capital. And so Raymond Townsend from Caffeinated Capital and Himanta Narja from General Catalyst led the round. Also joined by our previous investors like 8VC and all the great investors. We were really lucky to have. I'm super excited about this round. Really, the goal of this round is to continue in building the services for our growing member base, expand into new categories, and then just continue to grow in our partnerships with both payers, providers, and health systems.
Great. Excellent. Well, I don't know, with all, the running the company and raising money, if you have time to read anything except for, legal documents, term sheets, definitive agreements, and so on. But on the off chance that you have, are there any books that you would recommend for our listeners?
Yeah, I do try to read books or listen to them. I really enjoy a lot of the leadership books. Some classics, or ones that have come out in recent years are really good. I think one that's a little more off the beaten path that I read and really enjoyed was Leadership and Self-Deception: Getting Out of the Box. You're nodding. So you
Yeah,
read
it's a
this
good
one.
one.
It's a really good one. I just felt like it really reframes things for you. It makes you really think of how you manage yourself within an organization, how other people are showing up, how to be a good and kind of functioning team and company. And I felt like it's applicable both professional life and personal life. So I would really recommend that one.
Well, great. Well, Naama Stauber Breckler, co-founder and CEO of Better Health, thanks for joining me today on the Health Biz Podcast.
Thank you so much for having me, David. Bye-bye.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.